Hello, I'm Barb Tassel, and I will be your narrator for this topic as we explore the changes that are occurring in healthcare today, especially in the primary care setting. Specifically, we will be looking at how the role of the RN is changing to better support patient care. This education is supported by the Health Resources and Services Administration, or HRSA, of the United States Department of Health and Human Services. You may be wondering why primary care is changing. As with all other aspects of healthcare, primary care has been affected by many changes in our society. First of all, there are more patients and more older patients. According to the U.S. Census Bureau, there is an estimated 73 million Americans now aged 65 or older. Advances in healthcare have led to longer life, but have also brought more chronic diseases. In 2010, the Affordable Health Care Act provided broader coverage for medical insurance, which has led to more patients seeking medical care. Also, over the past few decades, there have been a strong focus on disease prevention and management to improve outcomes, instead of just managing symptoms. There are two additional aspects of healthcare that are contributing to changes in primary care. First of all, there are fewer medical providers choosing primary care. According to the Association of the American Medical Colleges, there is a projected shortage of over 55,000 primary care physicians by the year 2033, which includes internal medicine, family practice, and pediatrics. During the same time frame, the number of nurse practitioners is predicted to increase by 45%, especially in the primary care setting, which will introduce a stronger nursing model and the need for more RNs, as well as changes in delegation and supervision needs. Provider burnout is another strong influence on the changes in primary care. The level of burnout has increased for the past 15 years and has created higher suicide rates, fewer providers opting to work in primary care, and decreased productivity for providers still in practice. The graphic on this slide shows some of the causes of this burnout, including time pressure, perceived poor control over the pace of their work, and electronic health record complexity. I want us to pause for a minute and think about why it is so important to have a strong primary care service for those increasing numbers of patients that we talked about. Research has shown that early and consistent use of primary care services leads to improved patient outcomes such as cancer, diabetes, and cardiac outcomes. It leads to improved use of healthcare dollars, and we know that we all have to work on reducing healthcare costs. And primary care services have also shown to decrease health disparities. The graphic on this page shows the percent that different factors have on health. Within these factors, access to care, which is 10%, and healthy behaviors, which is 30%, are both social factors that can be impacted by primary care. So what can help? One of the answers is the 3.7 million RNs in the U.S. The Macy report is an in-depth analysis of the issues in primary care. This analysis found that if more RNs worked in primary care at the top of their license, they would help support the patient care needs and allow providers to function within their role in a more satisfying and effective way. At this time, nurses are underutilized in the current medical model of primary care, and there are several reasons. Nurses are not prepared for primary care at the top of their license, and we'll look at this in more detail later in this module. And sometimes the organization's policies or state laws limit what the RN is allowed or expected to do, and both of these may need to be changed. How can these changes get started so we can better support all of the patients who need care? There are multiple grants in place supporting the integration of primary care knowledge and skills into pre-licensed nursing education and supporting further education of licensed RNs who are currently or may soon be working in primary care. Mary Delansky explains the HRSA grant, which has supported this education and is supporting other changes in Northeast Ohio.
I'm Mary Delansky, and I am the principal investigator for the study, and I'm very excited to talk a little bit about the opportunity that we have in nursing now to make a big difference in primary care nursing. And what the grant is about is teaching nursing faculty and integrating primary care skills and competencies into undergraduate nursing education. And the second part of our work is to empower the nurses in primary care to work to the top of their license. These are two very important concepts in order to improve care for patients across the country in outpatient care. The reason is that there is such a demand for primary care, and RNs, registered nurses, can play such an important role in that, alleviating some of the burden from what providers are experiencing, and take on some of the roles that are really needed for our patients, such as chronic disease management, also helping patients to self-manage their chronic diseases or their situations, educating the patients, and really understanding if the patients are completely understanding what it is they need to do when they are home and managing their care. Most of the outcomes that we know with patients in chronic disease includes or really depends on the patient being an active partner in their care. So that's the role of the registered nurse. Some of the skill set that the RNs are really being asked to work to the top of their license are in accountability to ensure that patients really do take accountability for their care. So registered nurses are looking at registry data and looking at outcomes and generating reports to show on their panel of patients that they're caring for what percentage of their patients are attaining the levels of care that are indicating that they're meeting it. For example, diabetics. What percentage of their patients actually have hemoglobin A1Cs that are within normal range? Blood pressure. What percentage of their patients are really being controlled with their blood pressure? These are essential components of accountability that the registered nurse can play a very important component in. Some other skills that registered nurses are being asked to perform in primary care is quality improvement, where the registered nurses are looking at the system of how care is being delivered in primary care and how nurses can make, along with other team members, a difference in that system so that the system is actually helping to facilitate the care that is being delivered. So these are the exciting parts of our nursing. We're really excited to complete this grant because we are actually implementing strategies for both sides at the School of Nursing and then also at the clinic sites to ensure that the nursing students who are coming into the clinics are getting great preceptors and are getting a great experience to learn about the registered nurse's role in primary care to activate patients so that care outcomes are better.
Let's listen to Becky Mitchell as she describes some of the changes in healthcare over the years and how they have impacted nursing practice.
In the late 1800s and the early 1900s in the United States, nursing worked with immigrants living in cities and close quarters. They worked with pioneers dotted across America, and especially in the Appalachian Mountain areas where it sometimes took hours or days to get to the nearest town, the nearest medical care. Nursing also worked with Native Americans with limited healthcare resources, especially once they were moved onto reservations. We were in these communities working with these populations who were in need of nursing and medical care. It was around the mid-1900s when healthcare shifted from these communities, the homes and the families, to something more institutional, the hospitals, more science and research. To fill that growing need for nursing care in hospitals, nursing education actually shifted its focus to this hospital care and hospital procedures and moved away from the community nursing and population health. It wasn't until the late 1900s and the turn of this recent century that we started seeing a recognition that the United States healthcare system was flawed. Americans did not have access to care, and the care that we had targeted fixing these healthcare problems, not preventing them. This recognition and the years of discussion that went with it led to the Affordable Care Act, or the ACA, in 2010. The ACA was meant to make health insurance more affordable for all Americans and to lower the cost of healthcare. Nursing is recognized as critical to the transformation of our healthcare system. Literature documents the role nursing can play as we move forward to a model of primary prevention acute intervention, and chronic care management. Nursing Outlook in 2015 published an article called The Role of the Registered Nurse in Primary Healthcare, Meeting Healthcare Needs in the 21st Century. The American Academy of Nursing's position paper, The Role of the Registered Nurse in Ambulatory Care, came out in 2017. One of the most pivotal papers was released in 2011, right after the ACA was published. It was by the Institute of Medicine. It's called the Future of Nursing Report. Many people are familiar with that. I'm going to quote from that article. While changes in the healthcare system will have profound effects on all providers, this will undoubtedly be true for nurses. Traditional nursing competencies, such as care management and coordination, patient education, public health intervention, and transitional care, are likely to dominate in a reformed healthcare system as it inevitably moves toward an emphasis on prevention and management rather than acute hospital care. So this is a major shift from the hospital setting back to the community. The Josiah Macy Foundation supported a report called the Registered Nurses Partners in Transforming Primary Care. It came out in June of 2016, and it contains some statements about the way primary care nurses will function in the future, and the fact that we don't have enough primary care nurses. There's a scarcity of nurses adequately prepared to perform primary care functions, and payers not reimbursing for work performed by some of the members of the primary care team, and that includes RNs. To address this scarcity, this report suggested that we need instructional programs that will need to offer opportunity to specialize in primary care.
As we continue to look at how RNs can impact primary care, Becky Mitchell explains the types of care provided.
Because for patients served by primary care teams, registered nurses will take on prevention and healthcare promotion activities. They will take on minor episodic and routine chronic illness management, and they will participate in complex care management in conjunction with other team members. Nurses will also engage in population management and quality improvement initiatives, as well as provide care in alternate manners, such as telehealth.
In addition to working directly with patients, as Becky just described, the Macy report also identified aspects of the practice operations when RNs can have a positive impact. RNs can guide others in phone triage and help prioritize patients and coordinate services. RNs also dramatically impact the patient flow and capacity of the office or clinic, as they frequently assess for same-day or after-hours care needs. Additionally, taking on the formal and informal leadership roles, the RNs help to supervise the work of others and facilitate teams, projects, and quality improvement initiatives within the practice. Faculty and nursing educators in multiple roles will play a significant part in developing the competencies needed to take on these very important tasks.
This is an ideal state. We are not there yet. To support this transformation in care and to reach an ideal state, nursing and other healthcare faculty will need to include opportunities to learn and practice competencies that are required in this new primary care setting. They need to recognize that knowledge, skills, and attitudes already included in nursing curricula are transferable to the primary care setting. However, if we do not include primary care examples for new learners, they may be unable to transfer all of these skills, all of this knowledge, and their attitudes that are so important into the primary care setting. Examples of primary care competencies that may not be in the nursing curricula or are pretty difficult to measure, so holding those students accountable to them is difficult, include the following: an assessment of health literacy and patient education based on that. Using this educational opportunity to engage the patient in self-care. Listening for those patient health care goals. The act of listening is such a lost art. When you find out those patient health care goals, using your skills in motivational interviewing and coaching to support patients toward their stated goals. And finally, in that same area, advocating for the patient's goals. Their goals determined by them, not by a healthcare system. Recognizing and owning nursing's scope of practice and their code of ethics. That includes working to the top of your license, using patient-specific orders to guide your nursing visits, whether they're face-to-face or through telehealth. Engaging in teamwork and collaboration, having a common mission and vision for your healthcare team, which includes the patient. Don't forget that your healthcare team includes the patient as a member. Engaging in continuous process and quality improvement. That error reduction, targeting goals for population health, moving that dial on hypertension or diabetes or weight control, keeping your population healthy. Knowledge of how to access needed healthcare team members. Sometimes it's not enough to have a nurse and a provider. We need social work, we need mental and behavioral health, pharmacy and nutritionists to help us help our patients stay in a state of health. Professional growth and behavior is also important. Accountability to yourself, your team, and your patients. Making sure you develop a self-awareness, a resilience, and coping mechanisms so that you can function in an optimal manner in the primary care setting. Making sure you yourself are engaging in self-care. This builds empathy for the patient when they're trying to reach their own goals, and it also gives you insights in ways that you might coach your own patients in primary care. Practicing giving and receiving feedback. Teams will have conflicts, and you need to learn how to resolve those conflicts, support your team members, and have those crucial conversations. And then learning to build sustainable relationships, because it is the relationship that will most influence the patient's healthcare goals, movement towards those goals, and finally, your own team's success. There are key domains in that list of competencies. The key domains in the primary care setting include shared decision-making, working with your patients to come to some decisions about how they want to manage their own health care. Interprofessional collaboration, working within that team. Performance improvement, both your own professional performance, as well as looking at your system and your team to make sure that you are engaging in continuous quality and process improvement. And lastly, sustained relationships, building relationships and assisting individuals and families to maintain health over time.
Well, that is quite a long list of competencies that are needed in primary care when the RN is functioning at the top of their license. So let's explore more about this concept called top of license practice. Top of license practice is RNs practicing to the full extent of their education and training, and that does not always happen for a variety of reasons. There are several things that can limit nurses from functioning at the top of their license. Nurses may not have the knowledge and skills needed in primary care, which is why there's a strong focus on making curriculum changes for nursing students as part of this primary care change. Employers or the practice model in place can limit what is allowed or expected. For instance, in some offices, RNs only act as care coordinators and don't actually see and interact with the patients, so they can't provide the assessments or education that would benefit those patients. Sometimes nurses are unaware that they can do more, such as aspects of patient education or community referrals. There's also a wide difference from state to state in what RNs and APRNs are allowed to do. and this is something that needs to be addressed from a national perspective. Also, reimbursement structures often will not pay for care and services provided by nurses, such as wellness visits and care coordination, but they will pay if completed by physicians. Again, this is something that needs addressed from the national perspective. So you might be wondering what top of license practice looks like in a primary care setting. Two of our local nurses talk about what top of practice means to them.
My vision for working at the top of my license would include being fully independent with any and all functions under the umbrella of nursing, ensuring that the patient's medical care and social resources are optimized for holistic support. I think when they know that we're able to help them in more than one aspect of their lives, they are able to really put that focus into their medical care. We reduce some of the outside issues that they're having and get them what they need just so that they can function independently. After all, it is about the patient. This is patient-focused care and patient-centered care. Thinking about a time that I was actually able to function at the top of my scope was when I had a patient scheduled in a blood pressure clinic. We do like RN blood pressure checks, and the patient's plan was outlined. So the doctor previously saw the patient, made adjustments to the medication, and he was to see me. If the blood pressure was over the goal, then I was to discuss with the patient the changes that would be made. So when the plan was laid out clearly, it was really easy for me to review that with the patient. It saved time with me precepting with another provider in the back, and I was able to show the patient how to use his blood pressure cuff, review dietary information with him, and the next time he came back, his blood pressure was under control. So it was something that I really enjoyed, being able to work with him and establish a good rapport with him.
My vision for working at the top of my license incorporates multidisciplinary and interdisciplinary collaboration, nursing leadership, impacting health population in a positive way. It goes beyond just diagnosing, treating disease. It impacts everything that occurs in a patient's health. The RN is uniquely positioned to do that on a daily basis. I had a great opportunity not long ago working in oncology, where we had to contend with patient anxiety at the beginning of diagnosis and toward the end of treatment. Whenever you're working with patients that are having acute disease, chronic disease, they need a lot of support. What we were able to do to help these patients, we did a study that allowed us to find out when the nurse should come in, do education, provide support after diagnosis, before treatment, in order to better prepare the patient for a good experience. What we found at the end of the study, that is, when an RN got involved early in the process of treatment for the patient had not only better outcomes clinically, they had much higher patient satisfaction. In essence, my patients felt that they were supported, and they felt they were being taken care of. So it was a really good experience.
A lot of nurses worry that top of practice means they won't be following the nursing process. The nursing process and nursing knowledge is absolutely critical in every aspect of care and are emphasized when the nurses function at the top of their license. In primary care, the nursing process from assessment to evaluation is used in face-to-face visits as well as telehealth or virtual visits. Reba Rogers has a great example of how applying the nursing process in top of license care benefits patients.
My vision for working to the top of my license is to identify veterans who require coordination of care on our team. This is done by identifying veterans with CAN scores ranging from 99 to 95. These are veterans at high risk for hospital admissions or death within a 90-day or 1-year period of time. Clinically reviewing their charts and presenting a plan of care to the team that best benefits the veteran, I can educate veterans on chronic disease management, disease prevention, and wellness. By identifying the high-risk veterans through a clinic review of the chart, I can assist with coordination of care for the veterans. Also, through chronic disease tracking, I have linked many veterans with services and resources based on their needs. For example, home-based primary care consults, telehealth, shared medical appointments, RN clinic visits, nurse visits with our certified diabetic educator, and others. At our huddles, we discuss plans for goal of care for high-risk veterans I have identified. Something exciting about primary care is being a member of a team and being able to partner with the veterans to meet their overall health care goals and needs. Advocating for the veterans, assisting veterans with multiple ways to assessing their care.
RNs working in primary care can play a critical role in coordination for patients that is receiving care in several parts of the healthcare system. Transition from one level of care to another has improved over the past 20 years, but there are still many opportunities to assure that patients' care remain consistent and that silos of care don't negatively impact the patient. Primary care RNs also work across care settings to assure that evidence-based care is implemented and standardized. For example, the RN may communicate with pharmacists and certified diabetes educators to confirm that they're using the same updated clinical guidelines for a specific medication before guiding a patient to those resources. As we conclude this module, let's listen to 2 examples of how the work of the RN in primary care makes a significant difference in the outcomes for the patient and how it can change the patient's quality of life.
First, we need to be sure that we understand the model that we use for primary care nursing, and that's the AAA model. There's 3 components of this model. We look at the patient experience, we look at the population health experience, and then consequently we look at the cost, and we're looking for a reduced cost. So it's obvious, when you have a patient, you look at their experience. If they're happy, if they're knowledgeable, if they understand their disease, then there's going to be increased compliance and better health outcomes. When we look at a population, and a population has different definitions. You can look at a population such as childhood obesity, and that's a group that just has similar outcomes. They desire to have the similar outcomes. It might be a group of adults that have similar outcomes of congestive heart failure. So you look at the children, and you know that with childhood obesity, we have the consequences of possible hypertension or childhood diabetes. If we work with them and we're able to reduce the childhood obesity, then we potentially could reduce the poor outcomes or the diabetes and the hypertension. Same thing with congestive heart failure. You look at an adult, they have congestive heart failure. You want to be sure that they're knowledgeable, that they know how to care for that, how to report the signs and symptoms, how to have a proper diet. If we are able to encourage the patients and educate them, most likely we'll have better health outcomes. So we use the AAA model because with the population or the individual experience, then when they have positive health outcomes, you have a reduced health cost because obviously we're going to be sending people to the hospitals less and less. So currently we look at chronic healthcare trends, and right now we can see that 80% of the $2 trillion that we spend in healthcare is spent on chronic diseases. So obviously we need to do something about this. This is where primary care comes into play. Initially, we have a patient that might have a chronic disease seeing their primary doctor, then they go see their cardiac specialist, the neurologist, or whoever they need to see for their specialist. Each one of these people are going to order possibly blood work, possibly imaging, and it's duplicated. Obviously, duplications are increasing costs. If we have the primary care provider, which is the RN, caring for this and coordinating this and is accountable for the patient care, we'll see a reduction in cost and we'll see a coordinated care. So this is the goal of the primary care, is to try to bring all these disciplines together and to coordinate it. The RN often works as a transitional care manager, where they are caring for these patients as they transition from whether it be the hospital or whether it be a skilled facility or whether it be home care, and they're caring for them and they're making sure that there's a continuity of care for this patient. So this is the responsibility of the RN care coordinator. Okay, so basically what I've just described is the patient traveling through the healthcare system. They start in the hospital. When they leave the hospital, the care doesn't end there. It'll continue on in the home, with home care. It could continue on in a nursing home, a skilled nursing facility, acute rehab, but it's the responsibility of the primary care provider to coordinate all this care and to be sure that they follow up with this patient and that they know what happens to the patient when they're discharged from the hospital or when they're discharged from home care or when they're discharged from the skilled nursing facility, and that they then come back to the primary care provider so that there's care that is continued, so that the medications that they were on are continued to be prescribed, or so that they continue to see the patient and to know the signs and symptoms or what is happening with the patient to provide for improved health outcomes.
It's important for the RN to understand when they're working in primary care, you have a unique opportunity to not only treat disease as it occurs, but to prevent disease. That requires a great deal of education for the RN. That requires a great deal of preparation for the RN. They get to integrate with the patient in their entire holistic health process. As an RN in primary care, you can impact their health for life, not just in the moment. You educate them, you get them into better routines, healthy lifestyle practices. You make them healthcare literate. You provide them with an opportunity to take the reins of their own healthcare. I think that is the crux of the impact of primary care, is that we aren't just treating a patient and setting them free. What we're doing is we are educating them for a lifetime.
Thank you for your interest in this topic and for all you do to support patient care and the nursing profession.